Gallstones are small, hardened deposits that form in the gallbladder, which is a small organ that sits under the liver in the upper right part of your abdomen. It's connected to the liver and the small intestine by a series of tubes called bile ducts. The main job of the gallbladder is to store bile, which is a greenish-yellow fluid produced by the liver that helps digest fats in our diet. When you eat, especially foods high in fat, the gallbladder contracts and releases bile into the small intestine to help break down the fats. However, when there's an imbalance in the chemical composition of bile, gallstones can form. Bile is made up of several substances, including cholesterol, bile salts, and bilirubin, which is a waste product from the breakdown of red blood cells. When there's too much cholesterol or bilirubin in the bile or not enough bile salts, these substances can crystallize and form stones. These stones can range in size from as small as a grain of sand to as large as a golf ball. In many cases, these gallstones remain unnoticed and do not cause any symptoms. However, if a stone obstructs one of the bile ducts, it can cause intense pain and other serious complications. Gallstones are surprisingly common, especially in Western countries. It's estimated that about 10% to 15% of the global population will develop gallstones at some point in their lives. In the United States alone, it's estimated that about 20 million people have gallstones, though many are unaware of it because they don't experience symptoms. The prevalence increases with age, and women are more likely to develop gallstones than men. Types of gallstones. When it comes to types of gallstones, they are categorized them based on their composition. Number 1. Cholesterol stones. These are the most common type, making up about 80% of gallstones. They're composed primarily of hardened cholesterol. Number 2. Pigment stones. These are darker in color and are made up of bilirubin. They're more common in people with certain medical conditions, such as cirrhosis or blood disorders. Number 3. Mixed stones. As the name suggests, these contain a mixture of cholesterol and pigment. Causes of gallstones. The causes of gallstones are closely tied to imbalances in the substances that make up bile. As mentioned earlier, cholesterol stones form when there is too much cholesterol in the bile. The risk of these cholesterol stones is higher in individuals who are overweight or obese, as they tend to have higher levels of cholesterol in their bile. Rapid weight loss can also increase the risk, as it can cause the liver to secrete extra cholesterol into the bile. Diet can influence gallstone formation as well. Diets high in refined carbohydrates and saturated fats may increase the risk, while diets high in fiber may decrease it. Ironically, very low-calorie diets can also increase the risk, as they can cause the gallbladder to contract less frequently, allowing bile to become more concentrated. In the case of pigment stones, the underlying cause is typically an overproduction of bilirubin. Bilirubin is a substance created during the breakdown of red blood cells. Certain medical conditions can cause the body to produce excess bilirubin, which leads to the formation of pigment stones. One common cause is liver cirrhosis, which is a disease that scars the liver and affects its function. Other conditions include biliary tract infections and hemolytic anemia, which is a blood disorder where red blood cells are destroyed faster than they can be replaced. When bilirubin levels rise, the excess binds with calcium, forming hard stones in the gallbladder. There are several other risk factors that can contribute to the development of gallstones. Genetics play a significant role. If you have a family history of gallstones, you're at higher risk of developing them yourself. Some ethnic groups, particularly Native Americans and Mexican Americans, have higher rates of gallstones. Gender is another factor. Women are about twice as likely as men to develop gallstones. This is thought to be related to estrogen, which increases cholesterol levels in bile. Finally, we have age. As we get older, our bodies tend to secrete more cholesterol into bile, increasing the risk of stone formation. This is why gallstones are more common in people over 40. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Symptoms of gallstones. The symptoms of gallstones can vary widely. In fact, many people with gallstones never experience any symptoms at all. These are called silent gallstones and often don't require treatment. However, when gallstones do cause symptoms, they can be quite uncomfortable. The most common symptom is pain, often referred to as a gallbladder attack or biliary colic. This pain typically occurs in the upper right part of the abdomen and can radiate to the right shoulder or back. Gallbladder attacks often occur after eating fatty meals, as the gallbladder contracts to release bile. The pain from a gallbladder attack can be intense. Many people describe it as a constant, dull ache that increases in intensity over time. It can last anywhere from a few minutes to several hours. Some people experience nausea and vomiting along with the pain. Other symptoms can include indigestion, bloating, and intolerance to fatty foods. Some people may notice changes in their bowel movements, such as lighter colored stools or darker urine. What's concerning here is that if a gallstone causes a blockage that leads to inflammation of the gallbladder, which is a condition called cholecystitis, symptoms can be more severe. In this case, the pain may be accompanied by fever, chills, and a rapid heartbeat. The abdomen may also feel tender to the touch. In severe cases, when a gallstone blocks a bile duct, it can cause jaundice, which is yellowing of the skin and eyes. Diagnosis of gallstones. When gallstones are suspected, a doctor will typically begin by taking a medical history and asking about symptoms. During the physical exam, the doctor may press on the abdomen to check for tenderness or swelling in the area of the gallbladder. They may also look for signs of jaundice. Imaging tests are crucial for confirming the presence of gallstones. The most common test is an abdominal ultrasound. This painless, non-invasive test uses sound waves to create images of the gallbladder and can usually detect gallstones quite effectively. It's often the first test ordered when gallstones are suspected. If more detailed imaging is needed, a test called endoscopic retrograde cholangiopancreatography, or ERCP, may be performed. This involves inserting a small, flexible tube with a camera into the digestive tract to view the bile ducts and gallbladder. ERCP can also be used to remove stones that are blocking the bile ducts. Treatment for gallstones. The choice of treatment depends on several factors, including the severity of symptoms, the size and number of stones, and the overall health of the patient. If gallstones are not causing any discomfort or complications, they may not require treatment at all. In many cases, asymptomatic gallstones can be safely left alone, with no need for medical intervention. However, if symptoms are present, or if a gallstone is blocking a bile duct and causing pain or inflammation, treatment is usually recommended to prevent complications. The most common treatment for symptomatic gallstones is surgery to remove the gallbladder, which is a procedure called a cholecystectomy. This might sound drastic, but the gallbladder isn't essential for digestion, and most people do fine without it. The liver continues to produce bile, which drips continuously into the small intestine instead of being stored and released in larger amounts. Cholecystectomy is typically performed laparoscopically, meaning through small incisions in the abdomen. This minimally invasive approach usually results in less pain and a quicker recovery compared to traditional open surgery. Most people can go home the same day or the day after surgery and return to normal activities within a week or two. After gallbladder removal, most people don't experience significant long-term effects. However, some people may notice changes in their bowel habits, such as more frequent, softer stools. A small percentage of people may develop chronic diarrhea, which can usually be managed with dietary changes or medications. For people who can't undergo surgery, there are non-surgical options, though these are generally less effective and often temporary. Medications called bile acids, or sodioxycholic acid, can be used to try to dissolve small cholesterol stones over time. However, this treatment can take months or even years to work, and stones often recur once the medication is stopped. In some cases, gallstones can be removed without removing the gallbladder itself. This is often done using ERCP, which is a procedure where a small camera and instruments are inserted through the mouth and into the bile ducts to locate and remove stones. ERCP is particularly useful for treating stones that have become lodged in the bile ducts and are causing a blockage. Once the stones are removed, bile flow is restored and symptoms typically resolve. In other specific cases, a procedure called lithotripsy might be used. This involves using shock waves to break up gallstones into smaller pieces that can pass more easily. At the end, with proper management, most people with gallstones can maintain a good quality of life. Now, we want to hear from you. Have you ever experienced gallstones or know someone who has? How did you manage the symptoms, and what treatments worked best for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.